Good afternoon, everybody. This is your host, David, with Strategy for Strength. Today, we're going to begin discussing techniques to help you both prevent and manage your hip and low back pain. Before we get started today, I want to remind you, always see your doctor before beginning any exercise program or trying any of the techniques discussed here today. Let's use these trees as an example, the trunk of the tree being the problem. What do trees have? They have roots growing up into them. So what does that mean for us? Your hip or low back pain has many things contributing to it, not just one big problem. So where do these roots come from? A lot of the time, it's lifestyle. Do you sit a lot? What are your lifting habits? Maybe you're lifting incorrectly, but we know one thing for sure. For the majority of us out there, one major contributing factor, or root if you will, is that we sit too much. If we sit too much, what does that do? It gives us something I like to call dead ass syndrome. Now, you ask, what is that? When the muscles of the hip are chronically in a seated position, the glutes become deactivated, weak, and unable to support the lower back. Anatomically, this causes the front of the hip to be super tight. When this happens, reciprocal inhibition occurs, which decreases the neural drive to the posterior muscles, primarily being the glute. When the glutes turn off and don't work anymore, other structures of your hip and your low back take up the brunt of the force, which is going to cause dysfunction, and you're going to feel it. This being the case, there are four main roots that have grown in order to produce your symptoms. Those are in the areas of tissue condition, tissue length, dynamic flexibility, activation, and strength. Today, we're going to address tissue condition, specifically the overactive tissue that is preventing you from using your glute muscles to support your lower back. To do this, we're going to apply self-myofascial and active release techniques. Using these techniques in conjunction with static and dynamic mobility drills, we can temporarily put the muscles of the hip and back into a state that they can be strengthened safely. This means that the effects of these techniques do not stick. They have to be repeated in order to correct this muscle pattern. It took a long time for you to develop it. It's going to take a long time for you to undo what you've done. As you can see, we got lots of things to address, don't we? Time to cut the roots off. Grab your training partner, and as my mama would say, get up off your dead ass. Let's go to the gym. To deal with the overactivity and muscle adhesions, we're going to use a foam roller and lacrosse ball. What we're going to do is apply high pressure to these areas to successfully inhibit them. In other words, we're putting pressure on them to tell them to turn off so that they can relax and allow the hips to work properly.